Hello everyone, my name is Nadezhda Griva and I am a member of ISTC team, and today we're going to talk about combating zoonotic tuberculosis, strategies, challenges, and the future directions of the matter. So, as a brief recap, the zoonotic tuberculosis is tuberculosis caused by special mycobacteria, Mycobacterium bovis, and its main transmission pathways are either through digestive route by infected dairy products or by direct contact with the livestock. There is also quite rare cases when the disease is transmitted by contacting with the domestic animals like pets, like dogs and cats, but it's really rare and doesn't have that much impact in the common population. So as you can see on the map, there are regions with the high and low distribution of zoonotic tuberculosis cases. So the red marked areas represent the regions with the count of about like 2% of such cases per year, and the high and the light blue region, such as Asia and Australia, they represent, or also Africa, there's like a bit darker blue. The proportion of the zoonotic tuberculosis cases can be really high and account for up to 5% of TB cases. And to take a look of the trend of the transition of the disease and of how many people get it yearly. Here's the graph of the rate of tuberculosis, zoonotic tuberculosis by region, and you can see that there's the high and mild increase in such regions as Africa, Asia, and South America over the years. And while North American and Europe, they maintain stable. So there are three main packs of bacteria that can cause tuberculosis in human, and the first one is the most known is Mycobacterium tuberculosis, which originates in human and causes the symptoms of tuberculosis. Everybody, like the can be presented with cough, mild fever, which or also malaise. Sometimes dizziness, but that is not a common sign. The second mycobacteria that can cause tuberculosis, Mycobacteria bovis, and it originates in animals and causes tuberculosis with more inclination towards extrapulmonary symptoms. And there are the third pack is the other types of mycobacterias, which also originates in animal, and they can cause tuberculosis in human with also mostly lung predomination. As we talk about economical impact, because zoonotic tuberculosis also has quite an influence on that. On the graph, you can see that countries who experience higher risk, higher incidences of zoonotic tuberculosis, they face export bans and trade disruptions, which could result in annual losses up to $60 billion yearly, which is a huge amount, as you may see. And there's the strategy which has been developed over the years to combat the zoonotic tuberculosis, and it is called One Health approach, which is a multidisciplinary framework that recognizes the interconnection between human, animal, and environmental health. And its core principle is the health of people is closely linked to the health of animals and to the environment. And therefore, combating diseases such that cross these boundaries, such as zoonotic tuberculosis, requires collaborative effort from multiple disciplines. So let's talk about some key components of this approach. And we'll start with the human health. So the healthcare providers use advanced diagnostic methods to detect zoonotic infections early. For example, in certain high-risk communities, integrating screening programs to develop the to define the disease early and to treat it well. Therefore, then the other important metric is surveillance and monitoring. And to do that, public healthcare systems need to create centralized database to monitor outbreaks and track disease trends, enable rapid response and containment. The animal health also has some main blocks we need to take care of. And first is veterinary care and livestock monitoring. An example, regulating screening and testing of livestock help identify infections early and prevent transmission to humans. Also, important part is animal vaccination program. And as such as also which includes research and development of vaccines. For example, in case of zoonotic tuberculosis, the BCG vaccine is crucial for protecting animals and indirectly reducing human infections. And for the environment, sanitation and control environmental factors matter. So we need to improve sanitation, managing water quality, and reducing pollution, and thus lower the risk of environmental transmission of pathogens. And another important part is wildlife management. An example, monitoring wild animals populations, which can be reservoirs for zoonotic diseases. And each of these key points faces some challenges. For the human health, it's considered zoonotic tuberculosis, it's delayed diagnosis because it can be misdiagnosed, and due to its mainly targets not lungs but other systems, so it's non-pulmonary manifestation. It can be under or misdiagnosed due to similarities also with the pulmonary tuberculosis. And if there's limited access to diagnostic tools in resource-contained settings, it can also delay the treatment. Also, the public health surveillance often operates in isolation with separated databases for human and zoonotic diseases. And this lack of integrated data hampers early detection and coordinated response. Also, Mycobacterium bovis has shown natural resistance to pyrazinamide, the main drug for treatment of Mycobacterium infection, such as Mycobacterium tuberculosis infection. And this complicates the therapy, so because we need to find some other solutions and other mycobacteria and antibiotics and agents that can cure the person affected. Also, there is an important awareness program. So communities may have low awareness of zoonotic diseases, resulting in delayed medical consultation and increased disease transmission. And also the misinformation about tuberculosis and its zoonotic forms can further complicate control measures. Veterinary infrastructure and services also suffer, for example, in many regions, especially in developing countries. Um, they face shortages of veterinary professional and diagnostic facility, which affects the regular screening and monitoring of the livestock. Also, costs and logistical challenges, such as implementing widespread testing and subsequent culling of affected animals in resource-intensive and vaccination program, often struggle due to logistical issues and inconsistent funding. Also, there are a lot of variability in veterinary practices and lack of standardized testing protocols, which also lead to inconsistent results in an ineffective control of zoonotic tuberculosis. There is also an impact of farmer resistance. So farmers may resist culling due to economical losses, especially when compensation from the government is insufficient. And traditional practices and lack of trust in veterinary interventions also can impede efforts to implement modern control measures. Inadequate sanitation in rural and peri-urban areas can facilitate the persistence and spread of zoonotic pathogens in the environment. Lack of clean water and waste management system contribute to the cycle of infection. Also, wildlife animals can act as reservoirs for zoonotic diseases, yet many regions lack robust system for the wildlife disease surveillance. And another factor is a human encroachment of wildlife habits increases contact between domestic animals, wildlife, and humans, which can result in a higher transmission of the disease of zoonotic diseases such as zoonotic tuberculosis. Also, environmental pollutants can compromise both animals and human immune systems, making population more susceptible to the infections. And industrial and agricultural waste, when not properly managed, exacerbates the spread of the diseases as well. So, how can we combat the disease? The first, one of the roads is managing diagnosis. So the higher the diagnosis levels, the more innovations are in that field, better we can define the disease and start the treatment and also prevent its transmission. So there are a few innovations such as portable PCR devices, which can help in diagnosing disease. So they are affordable, they are field ready, and it can be a great help for diagnosing in rural regions. Also, there is a system called Gene Expert MTB RAF system, which is a cartilage-based nucleic acid amplification test for rapid tuberculosis diagnosis and at the same time rapid antibiotic sensitivity test. So it's an automatic diagnostic test that can identify the infection and resistance to rifampicin. So this we can enhance diagnostic rates though underutilized due to its cost. So this can be an issue in developing countries due to also another economical impact and the cost. Another way to manage the zoonotic tuberculosis is vaccination. So some new BCG vaccines are developed and redeveloped for broader protection, and those vaccines also work not just against Mycobacterium tuberculosis, but also against Mycobacterium bovis. Uh, and this can have a potential for dual protection, people and the livestock animals. Advances in genomic sequencing uh, can also lead to early detection of the disease, by implementing modern genomic technique such as the whole genome sequencing, which enable rapid identification of pathogens and their variants. Also, using artificial intelligence predictive models uh, to to predict outbreak patterns based on historical data, climatic factors, and social economical indicators can help identify those outbreaks and be cautious and ready to prevent the spread of the disease. And another important part is policy and regulations, such as implementing food safety laws, as pasteurization of milk drastically reduces zoonotic tuberculosis transmission, and of course, livestock monitoring to control the disease spread. When summarizing, so the One Health approach is the key for it to work is collaborative framework and data sharing. So, human health agencies, veterinary services, and environmental organizations have to share the data on the disease outbreaks, laboratory results, and surveillance findings. And multi-sectoral task forces and working groups bring together experts from diverse fields to plan and implement disease prevention and control measures. And in conclusion, just a few key points to remember. So, zoonotic tuberculosis is a major global health and economic concern, and effective combat of it requires diagnostic policy reforms and coordinating global efforts. Meaning we need to invest in One Health collaboration, One Health approach, and enhance diagnostic and surveillance infrastructure. Here's some references if you want to find out more about this issue. And thank you for listening, and goodbye.